Okay, so let's get into wages and actual employee salary. So annual salary, annual compensation. I'm going to throw out a little formula at you so we can, uh, based on an hourly rate. So this is for our hourly employees, not our salaried employees. Salaried employees, pretty easy to calculate their salary. It's whatever it's set at, all right, whatever they're contracted to. Hourly employees, it depends on how many hours they work, what's their schedule like. So, quick formula for you, where we have some amount of normal time that is paid. I've got, let's say we're paying $15 an hour, so that 1 hour of normal time is worth $15. We've got overtime, so that's any hours worked over 40 hours per week. So if you work 48 hours this week, you've got 40 hours of normal time, you've got 8 hours of overtime, and that overtime being paid at time and a half. So normal time being paid at $15 an hour, overtime being paid at time and a half, or $22.50 per hour. Um, we've got that multiplied by 52, so that's 52 weeks. So how many hours did you work this week? Um, and we're just assuming 52 weeks. You might have a couple weeks off, but we're going to still throw in 52 weeks because those couple weeks off might be vacation time, might be sick time, so you're still getting paid for that time. Then we've got some sort of hourly wage. So what are you getting paid per hour? Is it $10 an hour, $15 an hour, $20 an hour? We can just plug that in and then multiply, add, and then multiply all that together, and we get our total annual compensation. Now we've got that formula for our hourly employees, but for EMTs, for paramedics, is it really all about just our um, hourly wage? So if I'm getting paid $15 an hour, there we've got that formula there on the left, and we've plugged in some numbers on the right. So I work a 9 to 5 job, 40 hours a week. My normal time, I've got 40 hours. My overtime is zero. So I have 0 hours of overtime, still working 52 weeks and getting paid $15 an hour. Works out to about $31,000 per year. So it works a little bit differently for EMTs, paramedics. We are not working a normal 40-hour week. And if you go to the Bureau of Labor Statistics, you can look up wage information on um, a lot of industries and occupations, including EMTs and paramedics. But the BLS calculates all of this based on a 40-hour work week. So it finds an average hourly wage and then just multiplies that by a 40-hour work week for 52 weeks and comes up with an annual salary. So the BLS numbers, Bureau of Labor Statistics numbers for EMTs and paramedics, it's a little bit skewed. It's not really the full picture because of the hours we work and the types of shifts that we work. But also because the BLS lumps together EMTs and paramedics. So if you're looking at an average hourly wage in North Carolina, it's going to pull that for EMTs and paramedics in the same pool and isn't going to break us apart. So contrary to the Bureau of Labor Statistics, we do not work a 40-hour work week. All right. So we've got a number of different preparation shift designs. We'll go through a few of the popular ones. First one being a 12-hour rotating schedule. So I'm on a 12-hour shift. I'm working day shift, 7 a.m. to 7 p.m. And I work this on a rotation where I work 36 hours in one week, work 48 hours the next week, and then I start all over again. Right. So most common of these is I'll work working every other weekend, Friday, Saturday, Sunday. So I work Friday, Saturday, Sunday, get a couple days off. Work Wednesday, Thursday, get the weekend off. Um, and it just kind of rinse and repeat, right? So working 36 hours one week, 48 hours the next week, and then we rinse and repeat that. So if we take our hourly wage rate formula here, we actually have to do it twice because we've got um, two types of weeks during that time period. So in 1 week, I'm working 36 hours. You can see that here. I've got 36 hours of normal time. I don't have any overtime because I haven't gone over that 40-hour mark. I'm multiplying that by 26 weeks because remember we have two types of weeks. I've got week 1, week 2, and then we rinse and repeat. So I've got 26 weeks where I'm working 36 hours, and if I'm still getting paid $15 an hour here. So I'm getting $14,000 for those 26 weeks. The other 26 weeks I am in overtime, so I've got my 40 hours of normal time, I've got 8 hours of overtime, and then since we want to calculate time and a half, we take half of my overtime hours and add that in on top of it, so I've got 4 extra hours added in, multiplying that by 26 weeks again, and $15 an hour. So for half the year, half of my weeks, I'm making $14,000. For the other half, other 26 weeks, I've got a little over $20,000. So I'm still getting paid $15 an hour, but as compared to that 40-hour a week 9-to-5 worker, making $31,000, now I'm making a little over $34,000 as my base salary. Another popular schedule is a 24-48, where I'm on duty for 24 hours and then off for 48 hours, and I come back for 24. There are lots of different designs for the 24-48, kind of come in different flavors, where sometimes you'll work a rotation and then have maybe 4 days off or 3 days off, little extra chunks of time here and there. So I just kind of picked a generic 24-48 schedule and went with it. So I've got 3 weeks where I'm working 48 hours in that week. I've got 1 week where I'm working 72 hours in that week. I've got 3 shifts in that week, and then those repeat themselves over and over again. So I've got 4 weeks to worry about in the year, and if we break that out, so we've got 3 weeks or one third. Excuse me. I've got 3/4 of my time of my year. I'm working 48 hours a week, so I've got my 40 hours of normal time, 8 hours of overtime, and we'll add in time and a half, so an extra 4 times 39 weeks, which is 75% of the year, 3/4 of the year. If I'm still making $15 per hour, it gets me to $30,000. And then for 1/4 of the year, I've got my employee working 72 hours, 3 shifts per week. So I've got my 40 hours of normal time. Here I've got 32 hours of overtime. So remember, I'm at 72 hours for that week. I've got 32 hours of overtime to get me to time and a half. We'll add in an extra 16. That's just for 13 weeks, just 1/4 of the year. Times $15 an hour gets me 17,000. Add that together, and now my base salary, even though I'm still making $15 an hour, so the same as my 12-hour shift brethren, now my salary jumps to $47,000 per year. The other really popular shift structure is a 24/72, where I am on shift for 24 hours and then off for 72, so I'm off for 3 days, and then I come back and work a 24-hour shift, and we rinse and repeat that throughout the year. So if we break this down, I've got out of 4 weeks, I've got 3 weeks in which I'm working 48 hours in that week, and then I've got 1 week where I'm just working 1 shift. I've just got my 24 hours in that 1 week. Plugging in our salary formula for our hourly workers. So I've got 3/4 of the year, 75% of the time, we were working 48 hours per week. So I've got my 40 hours of normal time, 8 hours of overtime, for my time and a half, times 39 weeks, and my $15 an hour gets me to about $30,000. But 1/4 of the time, I'm working 24 hours, just 1 shift in that week. So I've got my 24 hours of normal time. I've got no overtime, obviously, since I'm just working my 1 24-hour shift. I've got my $15 an hour. It gets me about $4,600. Add that together, so $35,000 per year for that employee working a 24/72 type of schedule. Now, that all kind of got a little confusing where all those employees, those 3 or 4 employees, were all getting paid $15 an hour, but we got very different annual salaries for them. So if we are just focusing on hourly rate, we're really missing a larger chunk of that picture, especially when we're estimating costs for next year and budgeting for next year. Um, we're going to be looking at our hourly wages, but we have to do the entire formula and really work in what is the base salary for each of our employees. So if we put all of this kind of into perspective, and I wanted to pay my employee $40,000 per year, but I've got 4 different shift structures, right? So maybe I've got an administrative assistant or a billing person working a 40-hour work week, a 9 to 5, come in Monday through Friday, does his job and goes home in the evening, no worries, no hassles, and I want to pay him $40,000 per year. What hourly wage, what hourly rate am I going to have to pay to hit that $40,000 a year? It's going to be a little over $19 per hour. Compare that down to that 12-hour rotating paramedic schedule. I'm paying him $40,000 a year. What am I going to? What's his hourly rate going to be? It's going to be a little over $16 an hour. So if we're just looking at hourly wages, that doesn't give us the bigger picture of annual salary. So um, you might have that 24/48 worker making $10 to $12 an hour, and complaining to his friend who's also a paramedic that works a 12-hour shift making $17 an hour, going, oh my God, I only get $12 an hour, you get $17 an hour. How unfair is that? Well, if we look at the annual salary, right, it's going to be the same. So it's going to be exactly the same if they're making $10.26 an hour versus a 16.03, right? So if we just focus on hourly rate, hourly wage, we're missing the annual salary, which might be the same. So as we're budgeting, as we're estimating costs, calculating costs for this year, next year, preparing reports, we're definitely going to have to go through our formulas and calculate the actual base salary for each of our employees. Now, you will lose employees every single year. There's really no organization anywhere that can say without a shadow of a doubt that none of their employees are going to leave, are going to quit, are going to find another job, are going to move, or anything like that. So you are going to lose employees for one reason or another. I would recommend trying to figure out what that reason was, conduct exit interviews to find out why that employee is leaving. But there is going to be a cost of that turnover. So each year we're also going to have to calculate and estimate what we think our turnover rate is going to be. We can typically calculate that using historical data. So every year we know, if you're in a larger organization, maybe 8% of your field personnel will leave each year. So we're going to factor in the cost of this employee turnover and how much does it cost to replace an employee. And this is something that's really easily overlooked. We think that Jeremy leaves and we hire Katie. Well, Katie's going to cost less than Joe because Katie has less experience and less seniority, and Joe, had been here for a while. So we might have some cost savings on Katie, but we have to factor in training costs, orientation costs, new hire costs, even the cost of the employee search. So we have to pay people probably overtime to fill Jeremy's spot until Katie is hired. We have to pay people maybe some overtime to conduct interviews or assessment centers. Just in that search process, there are going to be costs. So we think about what does it cost to replace an employee. It's usually 10 to 30%, depending on what you're doing. 10 to 30% of that employee's annual salary is just the cost to replace them. We mentioned just the search process itself is going to cost some money. You're going to have to get people together to interview, to conduct assessment centers. You're going to have to find people to fill in that spot until someone is hired in and fully trained to fill that spot. And you might even have some costs associated with advertising your open positions. But once a new employee is hired, there is some orientation process, and it's going to be dependent on your organization how long that training time is going to be. Is it going to be a 3-month process? Is it going to be a 2-week process? I have worked with agencies before where orientation was 16 weeks. I've worked with organizations where my orientation was 2 weeks, and I rode a few FTO shifts, and then they gave me their blessing and put me on the road by myself. So it just depends on your organization how long that training time is, and that's important because during that training time, that is not a fully functional employee. Right? You're still doing your FTO time. You're as a third rider, right? So you're just kind of taking up space in terms of budget and salary. So how long is your training time? Take that into consideration. And then what type of equipment, extra equipment do you need for that employee? You might be providing uniforms. Those come at a cost. You might be providing some sort of maybe turnout gear, extra extrication gear, extra safety gear. You might work in an area. So I worked in Charlotte, and we had 2 nuclear facilities in our response area. So each employee was issued some level of hazmat gear. So we have extra costs associated with just outfitting your employee on top of their training time. So after all this, you might be thinking, well, what do I pay my employees? What should I pay my EMTs? What should I pay my paramedics? What's a fair wage? And that's kind of a loaded term. It depends on how you define fair. But what's a fair wage? I'm sure you've seen lots of articles like this. Perfect side jobs for EMTs. Kind of gets me riled up a little bit. Many of you might have second jobs, third jobs, fourth jobs, because we're just not paid a whole lot, right? When it kind of comes down to it, we not only have a little extra time. If you're working that 24/72 schedule, you have got a little extra time for a part-time job, but we're just not paid a whole lot. So what should we pay our employees, and how should we go about thinking about this? So here's one posting I saw on the state's employment page, EMS employment page. Kind of made me a little angry. Part-time EMT being hired for some organization somewhere in the state. I'm not going to call them out on it, but somewhere in the state, looking for a part-time EMT, and at $7.72 or $7.25 per hour. That number looks familiar. It's because that is the federal minimum wage, and it's my own personal bias. The federal minimum wage is grossly low to begin with, and then should we be trying to attract our EMTs with a minimum wage? So hopefully you're offering more than just bare minimum wage to your employees, but the salary that you offer is going to be kind of a balancing act. So we want to offer a high enough wage that it attracts quality employees and keeps quality employees, but we also want to offer an annual salary that is not quite a budget buster that we can afford. So, I would love to pay every paramedic $100,000 a year and be just happy with it. But reality is we just don't have the budgets for that. We don't have the revenues to support that in many cases. So, what do we offer? So we can go back to our supply and demand curves here, where on my vertical axis, this is my price, this is my wage that I am offering my employees, and on my horizontal axis, my x-axis, the quantity of labor, the number of employees that I'm going to attract with that wage. And with my demand and supply curves there where they intersect, that's my equilibrium. If we remember back to our economics and our supply and demand. So at my perfect wage, I am going to attract the perfect number of employees that I need. and fill all of my spots, and I am fully fully employed, or have full coverage, and my employees are happy with that wage. If I offer a wage that is too low than what my employees expect or value themselves at, so we all, even if it's subconsciously, we all value ourselves at some annual salary. So if I offer a wage that is below what I value myself as, well, I'm going to leave the market, right? So this kind of gets back to the Lemons principle, and those used cars. Our high quality workers are going to exit the market. We're going to be stuck with, or left with, low quality workers, and we're going to see workers coming in and leaving fairly quickly. Average career span for a paramedic is about 5 years in the field. So we see our high quality workers leaving to go to nursing, to go to PA school. So we're offering a wage that is below what we value ourselves at. So that W1, that wage one, well, now I'm only getting a certain quantity of workers. I'm getting a lower quantity of workers willing to work for that wage rate. And if you've been to really any of the North Carolina OEMS open forums in the past probably year or so, you've probably heard them state this over and over again. If you go into Continuum and look up the number of paramedics that have a credential, we are far and above being able to fill every open paramedic spot currently open in the state. We just have a shortage of people who are willing to work for such low wages. So we don't really have a shortage of paramedics, just a shortage of people willing to work for low wages. So again, it's a balancing act between what we can afford and who we want to attract. Now, what goes into this balancing act itself is just our labor market, and what does our labor market look like? Because it's not normal. It is not. It's not a free, open market. So, just kind of float out a couple more economic terms. And is EMS an oligopsony, which is just a fun word to say, but might be an oligopsony. So oligopsonies are situations where there are very few buyers. There are multiple sellers, but very few buyers. So an open free market, there are numerous sellers and there are numerous buyers, and we find that equilibrium, that equilibrium point pretty easily, pretty quickly. But if we have changes in the number of buyers and number of sellers, we have changes in where in finding that equilibrium, or can we find that equilibrium? So oligopsonies, kind of the other side of monopolies. So if you think of a monopoly, there are a number of buyers, but there's only one seller. So if we have, let's see, a cell phone provider monopoly, there are lots and lots of us that have cell phones, so there are lots of buyers. But if Verizon was the only one offering service, that would be a monopoly. So there's only one seller, multiple buyers. An oligopony would be only one buyer, but multiple sellers. And then the opsonies deal with buyers. So an oligopsony, very few buyers, but lots of sellers. And we think of ourselves as EMTs and paramedics as sellers of our labor, of our time, and our organization, our agency as the buyer of our labor. Are we an oligopsony? I think we are. I would make the argument that we are, but I'll just kind of flip that question out for you to think about. So we've got EMS agencies, we've got ambulance agencies, whether they're 911 or interfacility transport, medical transports. So I'm a paramedic. I can work on an ambulance. I might be able to work in a hospital. There's relatively few hospitals that employ paramedics. If they do employ paramedics, they only employ a handful. So I might be able to work for a hospital. There's one in my area that employs paramedics. There are some physicians' offices, very, very few, that might employ a paramedic or two in the office. So maybe I might be able to work for a physician's office. But really, my kind of my only choice is an EMS agency and in my area, and are they hiring? Are they not? So in an oligopsony, the buyer has the power, and the buyer can lower the price of the good. And if we're talking about the good here being my labor, they are in the power seat to lower the price of that labor because, honestly, where else am I going to go? So I live in Haywood County, and if I were going to work for, full time as a paramedic in the field, I can go to Haywood County. I might be willing to commute to Buncombe County, or maybe a little further west to Jackson County. But I've got 3 or 4 agencies that I can work for, and compare that to if I were an accountant. There are dozens of accounting firms in the area. So what are my choices, and am I willing to lower my labor rate to have that job? Then comes the question, and again, this is one I'll leave up to you to think about, is I've got a low base salary, annual salary, but I've got really good benefits. I've got this state retirement system with a required employer match. I've got good health insurance in which I don't pay a monthly premium. My employer pays 100% of the premium. I've got good life insurance, good dental, vision coverage, um, and just good options overall. So should we be factoring in those employer benefits when we're talking about salary? Maybe we're negotiating salary with a potential employee. Maybe we're just talking with friends over a beer about how we don't make much money at all. Should we be taking these extra benefits um, into consideration when compared to private industry? And I've got a friend working in private industry, paying $200-300 a month just in his own health insurance premiums, whereas I can go and pay $20 a month for my health insurance premium. So does that factor into this discussion? And are these really good benefit packages kind of a substitute for an hourly wage? So me as an organization, I can't offer you a high salary, but because of other extenuating circumstances and cooperation with maybe a city or county organizations, we can offer you really good benefits. So where do those fit into our salary discussions? As always, if you have any questions, comments, concerns, cuss words, please let us know.